The detection and treatment of cervical cancer has gone through encouraging developments, and it's important to seek treatment from experts with knowledge and equipment that's state-of-the-art. You'll find it all at the Tulsa Cancer Institute. We have Dr. Michael Gold, who joins us this morning with important information about cervical cancer. Thank you so much for being here this morning.
Well, thank you for having me.
A very important topic to discuss. All right, when it comes to screening, to make sure we're getting that early prevention, how often do women need to be screened for this?
Well, it used to be that women need to be screened or were recommended to be screened annually, but current guidelines have changed due to a lot of research that's shown that really the pap smear and a test called HPV, human papillomavirus testing, are really very accurate at determining whether a woman is at risk or not. So current guidelines are that a woman 21 to 30 years of age be screened every 3 years with a pap smear, or women 31 and older be screened every 3 years with a pap smear, or every 5 years with a pap and HPV test.
All right, so you can really space them out if you want to.
You really can. You really can. Now, women are still recommended to have annual examinations by a gynecologist or someone who performs a gynecologic exam, but they don't have to actually have a pap smear.
What are some of the risks that are involved with cervical cancer?
Well, as I mentioned, human papillomavirus is the necessary factor in causing cervical cancer. So if a woman doesn't have HPV, she's not at risk.
Okay.
But in addition to that, anything that affects the woman's immune system will have benefits or risks for cervical cancer. So that things that inhibit the immune system's ability to get rid of that infection, smoking, for instance, autoimmune disorders, transplant drugs, all contribute to a prolonged infection with the HPV virus and therefore increase the risk. You
were telling me earlier that it's 100% preventable. How is that?
Essentially it is. Because of pap smears, we can detect abnormal changes long before a woman gets cervical cancer.
Okay.
So unlike breast cancer, where mammography is designed to find early cancers, for pap smears, we're actually looking for the pre-cancer changes. And when we find those, we have the opportunity to treat long before a woman ever develops cervical cancer.
That's great. So you have to get checked, you go in, and you guys have a beautiful facility that we're looking at right now. So patients can come to you in those time frames that you were telling us earlier, and you guys really have a lot of the gear that's going to help detect early.
We do. Now for primary screening, that's generally done in a gynecologist or a family practitioner's or internist's office. That can be done anywhere. It's when the screening becomes abnormal that women are generally referred to a specialist like a gynecologic oncologist.
Okay, and that's when they would come see you guys.
Correct.
And you have a lot of things you were telling me, improvements in prevention care that you guys have been able to develop.
We do. The use of the HPV test has made wonderful changes in detection. More recently, the FDA has approved the human papillomavirus vaccinations.
Yes.
As a matter of fact, they just approved a new vaccine last year that actually contains more types of the HPV virus and therefore prevents even more cervical cancer. And then, of course, treatments have improved. They're both more effective and they're also have less side effects.
Well, thank you so much for educating us on this. We appreciate your time this morning. Guys, it's some good things to consider. We're going to tell you how you can go visit them there. It is the Tulsa Cancer Institute at 12697 East 51st Street, 800-556-6056. And